Hand hygiene is considered to be the single most important aseptic practice in the medical office to prevent the spread of infection. Hand washing uses a combination of soap and friction to sanitize the skin and get rid of transient flora. Transient flora are microorganisms that are picked up on the hands during your daily activities. They are often pathogenic and are attached loosely to your skin. You can easily remove them by proper hand washing. Washing with a detergent soap breaks down and emulsifies dirt and oil on the skin. Hand washing is recommended when there is visible dirt on your hands, before eating, or after using the restroom. Sometimes you will need to wash your hands using an antimicrobial soap. This is known as an antiseptic hand wash. You will need to perform an antiseptic hand wash when you assist the physician with a minor office surgery. The antimicrobial soap and mechanical scrubbing action kills even more microorganisms. The soap also leaves a film on the hands that temporarily discourages the growth of microorganisms. Begin by removing your watch, or push it up your forearm to avoid getting it wet. All rings except a plain wetting band should be removed and put in a safe place. The sink is contaminated. Avoid coming into direct contact with any part of it. Stand near the sink, but don't touch the edge. If you do, your uniform will collect microorganisms. The faucets may be the dirtiest part of the sink. Use a paper towel to turn them on so that your hands don't pick up even more microorganisms. Adjust the temperature of the water so that it feels warm. Your hands will become dry and chapped if it's too hot or too cold. Microorganisms can lodge in the crevices of chapped hands and then be transferred to patients. Throw away the paper towel that has become dirty from turning the faucets. Without touching the sink, wet your hands and forearms, keeping your hands lower than your elbows. This downward position carries dirt away from your body and not up your arm. Do not turn off the faucets yet. If you do, you will contaminate your hands when you turn them back on to rinse. Leave the water running until you are done. Apply soap. Use about a teaspoon of liquid soap. Wash the palms and the backs of your hands in 10 circular motions, using friction to dislodge microorganisms. Next, wash your fingers with 10 circular motions too. Interlace your hands and rub your fingers back and forth to create friction. Rinse away the dirt from your hands by keeping them lower than your elbows, but not touching the sink. Your hands are your dirtiest part. Now that they are clean, you can wash your wrists and forearms without microorganisms spreading from your hands. Remember to use friction along with circular motions. Clean your fingernails with a manicure stick at least once daily. Keep them short and avoid wearing artificial nails, which can trap dirt and microorganisms. Now rinse your arms and hands, being sure to remove all of the suds. Wash your hands a second time if you have just arrived at the medical office to start your day, or if your hands have come into contact with blood or other infectious material. Dry your hands gently and thoroughly with a paper towel. This prevents your hands from becoming chapped. Discard the paper towel in a waste container. Use another paper towel to turn off the faucets and discard it. Every time you wash your hands properly, you are taking the most important step to stop the spread of infection.